dislocation, and fracture.
First is apex. Si apex, ibutan ninyo sa shoulder ni patient na siya. Then, ang bad side is dapat facing on the outside na siya. The good side should be on the skins of your patient na siya. So, place this one on the, katulad pikas ka ba? Okay. So, place the apex on the shoulders na siya, okay? The tails on the sides na siya. The next thing that you need to do is the base, okay? So, you are going to fold the base na siya, okay? Fold the base until you will reach to the lower side of the chest of your patient. Okay? So until maabot na sa lower chest. Okay, so once we reach to the lower chest na siya, then go back ni patient na siya, ari kasuyo, then magigot ka diri og square knot. Okay?
Pwede na simulog, sir.
Pwede sa? Pwede siya kayo diri. Okay? Ay, ayaw lang pag nipple tape diha kanang kita ginong nipple tape.
Why nipple tape?
Why nipple tape? Nipple tape.
You haven't tried
Okay.
it.
All right, next one. Okay, talaga sila. Okay. You'll actually notice after doing square knots, you'll actually notice one of the tails is taas. Okay. We will use the taas na tail na siya para hikot na sa apex na siya. Gets in you. This is to help secure the triangular bandage towards the chest of your patient na siya. Okay, so we'll fix. So yan pa lang. Then square knot. By the way, some of you might be confused sa square knot. Ikaw, kung ikaw ra maghigot, makuha nimo. Pero ini higot na nimo ka patient mura maglibog ka ba? Ikaw na magid mismo ang mo decide. Asa nimo ang right tail para nimo ug asa pud ang left tail na. Sige, ikaw ra masige maghigot na siya. Okay? So ikaw ra gyud magtimana na. Okay, so that's also a good kind of observation. What if mubo? Okay, what if di kaabot na siya? So if in case di kaabot, sumpayan na ito na siya lain na bandage na siya. So ato rin na inaro na fold na siya, then ihikot na yun sa going to the apex. Then for this one, dapat housekeeping na siya. Okay, don't forget to do some housekeeping na siya. Okay, so ito bang dyan? So this is how we perform kanang one. Yes, of course. This is how we perform kanang chest na bandage na siya. So imagine yourself if the injury sa tapat, same rin kapag sila o itsura na siya. That one underneath sa kamot ni patient. Making sure that the base at least reaches or passes through the wrist area ni patient, or at least half of the forearms na siya. Next is grab the apex and place the apex on top na siya until it reaches to the elbow of your patient na siya. Then ask your patient to hold it. Then i-fold na ninyo ano ka sides na siya. Okay? After that, you have to roll two of the tails na siya until it reaches to the forearms of your patient na siya. So inyura na siya i-roll, and i-roll na siya. Once it's being rolled na siya, then you also have to roll the two sides na siya, the two tails na siya. So i-roll pa rin yung dua ka tail. Ito yung tujuk-tujuk na kina diya. Okay? Once mubo na ganyan yung dua ka tail, then create a square knot on top na siya. Yes, please. Why babaw? Because diri magud is you have your arteries here. And if ever ari ka maghigot, so tendency ma-block nimo ang artery flow of the blood siya. So maglisod og kanang agyan na siya. Okay? After that, you can do housekeeping, and you can also use the apex to do housekeeping para matapunan ra ninyo inyong i-roll na siya. Okay? So that is how we create a bandage for the hands na siya, especially for burns na cases na siya. So at least the head of your patient is vertical na cut or horizontal na cut na siya. So you have to remember that one. Basta when we say vertical, varog. Kasi meaning up ang yan cut na siya. When we say kind of horizontal, higda na siya. Simple as that. So let's start first with the horizontal na cut na siya. So horizontal na cut, control the bleeding na siya. After that one, is it okay if we allow the patient to close their palm? If they have a horizontal cut?
No.
Why no?
Pwede. Mag-contract man yung muscle.
Mag-contract ang iyang muscle? Sige, unsa pa? Sakit pa? Unsa pa? Any other answers?
Depende.
Depende pag yun. Unsa pa pag-depende
Parang
mo
mag-close ang
Sakit.
Oh, di sakit. Ikaw nasamad na gani ka. Sakit din ang animal natin. Ha? Matandog ang samad na siya. Why? What does it mean when we say matandog? So every time you ma-stretch? Okay. Now you have to remember this one. Our goal is to control the bleeding na siya. As much as possible, dapat ato gina siya i-steal, especially if open wound si patient na siya. Now, you'll actually notice na ang cut siya kamot is horizontal na siya. And if you allow the patient to close their palm, ang iyang skin siya palm will actually close as well, which helps control the bleeding na siya. So in other words, pwede na nato siya i-close. And that is what we call close palm na bandaging na siya. So after the patient closes their palm, sige, close na siya. The thumbs out na siya. Then we will start using the bandages na siya to prevent the patient from opening back their hands, because if they open back their hands, mo stretch, mo open magbalik ang iyang open wound na siya. So bleeding might kanang continue na siya. Okay. Now for the closed palm na siya, fold your bandage into narrow bandage. Place that one on the wrist of your patient na siya. Okay. The first thing we need to cover is on the index finger the side and on the middle finger the side. So you have to use the tail that is opposite side of these two na siya. Okay. Now for example, we have this side na tail na siya, which is on the thumb side, and we have this side of the tail which is near to the pinky finger, small fingers as yan. Since kani man natong i-cover, then we will use the pinky na side na tail na siya, because it's the opposite side. So all you have to do is cover the back of the hands na siya, going to the two fingers and go back to the original sides na siya. Gets niyo? Balik lagi na siya sa original na siya. Then use the other tail na siya to cover the back of the hands na siya and cover the two fingers, the ring finger and your small fingers na siya. So cover that one, then go back to the original side na siya. Okay? Then use the two tail to roll na siya, and then higot din kong square knot on top of the hands na siya. Pwede na siya magbuksidor. Walay labot ang tab. Why? Because we are going to test, no? If ever ka nasakto na ito pag-bandage or dili na siya, or test if the blood is still flowing towards the hands of your patient. So meaning blood is still flowing na siya. So walay problema. Sakto na ito pag-higot na siya. Kaya namo ko yung bad, grabe kay ka hugot na siya. So hindi pislit mo na luspat na kayo siya, color. Okay, so if luspat na kayo color, meaning hugot na kayo yung pag-higot sa square nuts na siya and also the tails. Gets in you?
Yes.
And that's how you perform the closed palm na bandaging na siya. Okay? Sana ka na open palm na siya, because as much as possible, open na ka na palm na ni patient. So after ka na controlling the bleeding na siya, covering the wounds, the next thing we need to do is cover it with bandage na siya. So for covering, nano magdungan magyumog CR ka mundo?
Ano ba kinagbata oy?
Ay, piste. Wait, anyway, so for the open palm, you just have to memorize this steps. Thumb, pinky, and then thumbness. Yeah. So may pasabot na. Okay. We're actually talking about the tails of the bandages na siya. So this is the thumb na tail. Why? Because it's located on the thumb side na siya. So tingnan niyo, this is the thumb na tail. Then this one is the pinky na tail na siya. So this is on the pinky na or small fingers na sides na siya. Because when we use this to cover the hands of your patient na siya, kailangan mo na ito gamitan ng mga tails na siya. Okay? Now, the first move atong button is the thumb na tail na siya. Okay? So this is the thumb na tail na siya. All you have to do is roll it at the back of the hands na siya. Okay? Then, as we're gonna go to the top of the hands on the palm na siya, then go back to its original place na siya. Gets in you? Next, okay? The pinky na siya. Okay? So, ikaduha ang pinky na siya. Meaning, you are going to use the pinky na tail na siya. All you have to do is grab the pinky na tail, go to the back of the head, then go first underneath sa thumb na siya. Actually, there are a lot of techniques in doing this. Sana ka na open palm na bandaging na siya. But this one is the easiest one na siya. Nayuban complicated, maglibog ka sa kapadok. So, again, pinky from the back of the head, then underneath sa thumb ni patient, then go back to its original side na siya. Another one, pinky gyapon ang sunod na siya. So meaning kani gyapon na tail na itong gamiton to roll na siya. So all you have to do is roll it to the back and pass it through in between sa thumb yun o sa thumb na tail na siya. Tunga-tunga, okay? So inyo na siya ipaagi, then going to the... Okay. So when we say immobilize, sa kaya pasama na nga? Okay, dili na ito i-lihok na siya kaya because roll kita rin kaya. Huy! Okay. The more you move it, the more it causes damages na siya. The more worse ang injuries in patient, especially cases of dislocations and fractures na siya. Okay. I'm pretty sure again you have encountered kanang mga aksidente, no? And kasagaran din mo suits in your mind is ayaw hilapti or ayaw lihok, ma'am, ana na siya, ma'am or sir na siya. Kaya nga naman, the further they move na siya, the further mo worse na siya. So our goal is to make sure that we immobilize the injuries na siya. When we say immobilize it, helping, no, na dili mo lihok ang ilang injured na areas na siya. Now, in order to immobilize, we actually use splints na siya. Splints are tools that we use na siya in dislocations and also for fractures na siya. There are actually different types of splints na siya. So these actually are the different types of splints. We have anatomical splints. We have kind of soft. We have rigid or rigid splints. And then we have oh yeah, these are mechanical splits kasi sila. Then we have air splits. Okay. Yes, hangin. Okay. Alright, so what are anatomical splits na siya? So from the word anatomical, what does it mean? Anatomy, okay, which is your body parts na siya. So if ever one of your body parts is injured, either dislocated or fractures na siya, you can actually use one of your body parts as a split or as a support na siya. For example, aray mo jump na rin, fingers na siya. Okay? Common kind of problem with fingers is we have dislocations na siya. And probably fractures na siya. Okay? Who are these people na prone kayo mga injuries sa fingers? Okay, very good. So mga athletes. Okay, basketball, we volleyball. Volleyball actually, mas pinaka-common kaya naman sakit nun pa sa ilang kamot, especially ka na musa o bola na siya. Okay, now you'll actually notice na some players do take both fingers na siya. Why they take both of the fingers na siya? Usa nag-i-injured na. Okay, but the other one is used to support the other fingers na siya. Why kailangan siya og support na siya? This is to prevent para magliyok-liyok ang iyang injured na finger. This is also to prevent na mo-bend ang iyang fingers na siya kung naay laing support na siya. So that is what we call anatomical splints na siya. Meaning we use our own body parts to support or split the injuries na siya. Kasi kinala niyo ba? Ako sige, Laki yung tukboy kasi ka na. Dili kayo! Sama ko yan! Alright, next! Okay. Another options for us to immobilize is we have the soft splints na siya. The triangular bandage belongs actually to the soft splints na siya. From the word itself, soft, so meaning we use something to immobilize the dislocation or fracture, pero hubog na siya. So we have the, what we call this, the triangular bandages, we have kind of mga handkerchiefs, we can actually use it one, mga blankets, pillows, we also use it one for soft splints na siya. Then we have the rigid splints na siya. So when we say rigid splints, these are hard kahit na mga splints na siya. Especially if severe na ginang fractures or injuries ni patients na siya. So later on, with this, sa different fractures na siya, we will be using rigid splints na siya. Then we also have the air splints na siya. Air splints are not really common sa tuwa. No? It's not even that common sa hospital na siya. It's actually very common in kanang mga emergencies. No? Like for example, collapse ang building, na-trap ka. Okay, we actually use kanang air splits para paburuton ganito na siya, okay, and then secure your body parts na siya para dili po ka madatugan or at least man lang matagtag o nakadatog sa inyo. Motor vehicle accident, okay, so nabangga ka, napiit ang imong tail na siya. How do we make sure na at least inigtagtag na mo sa debris or tagtag na mo sa kanang mga metal na napiit sa imo, secure na dali mo tail. So magpaburot yun o kanang air splits na siya. Gets niyo? And more siya inflatable na split na siya.
Para di mapit.
Aside sa dili mapit na siya, once we remove the debris na siya, secure na dali mo tail. Dili mahulog or dili magliyok-liyok na siya because we already have the air splits na siya. This is actually very common in ambulance na settings na siya. Especially kanang mga trauma na kanang ambulance na siya. When we say trauma ambulance, these are the type of ambulance na mo cater ka ng mga vehicular accidents, falls, ka ng mga collapse ng mga buildings na siya. Okay? Now, for caregivers, usually we use okay, so let's start off with soft splits again, and let's go with the common areas where magka-dislocate or fractures na siya. Let's go with elbow. Elbow is the very common joint na magka-fractures na siya, especially for elderly clients na siya. Okay, daghan kami madawat na cases of kanang fracture sa elbow sa mga tiguang. Number one cause is kanang slip or slide. Okay, kani mo kanang mga tiguang, dili na kikabantay silang environment na sila, or probably di cannot balance well when walking or standing up na siya, or even kanang mga slide na mga surface na siya, so prone kis na to fracture. Ini katumbang ko na nila, usually ang ilang ituko di silang elbow na siya. So ituko na na yan, balik ito rin sa elbow na siya, then we have to secure that one na siya. So the question is, how do we secure elbow fractures na siya? There are actually two types of elbow fracture, whether it's closed or open na siya. So when we say closed elbow fracture, meaning obvious kayo ang iyahang balik, like you can really see na murag wala gid sa saktong porma ang iyang elbow na siya, pero ang bukog is wala pa ni gawas na siya. So that is what we call closed elbow fracture na siya. And when we say open elbow fracture, obvious na jud kayo nga ni gawas ang bukog na niya. Okay, not only dislocated but wala gid siya sa saktong lugar na siya, and also sana kana nakabuwak ang bukog ni patient na siya, and also again ni gawas. So that is what we call open elbow fracture na siya. Now let's start first with closed elbow fracture na siya. Okay, so how do you know, or what are the common signs and symptoms is whenever the patient is knife fracture or dislocation sa elbow na siya? So kani pa lang, if ingunani gani ang forma sa kamot ni patient na siya, suspect ka immediately na base dislocated or closed elbow fracture in itabon sa imuhang kanina area na siya. Okay, do not let the patient, or ipatry nimo, sir, sway ko straight sir, please do not do that na siya. Kaya wala magkita kita unsay nitabo gid sa sulod na siya. So ato gyud buhaton is to immobilize this one. Secure lagi nato na siya, making sure na dili ma-straight ni patient na siya. So how do we perform bandaging? So soft splits for closed elbow fracture na siya. So get a bandage na folded into a narrow fold na siya. Place this one on top of the elbow, so ari ka diri sa babaw na siya. Now, one of the tails, inyo na siya i-roll agi diri sa forearms. The other tail will be rolling on the arms na siya. The two tails will meet on the top again. Mag-switch places na sila. Like, for example, kanina tail, gikan siya sa arms. Okay, mag-exchange siya at na po siya dito sa forearm mo tuyok. Kani, gikan sa forearm, exchange sila at na po siya sa arm mo tuyok na siya. So mag-meet na po sila top until bububo ang tail, and then square na talaga. Gets inyo? Murag ang dagan sa yung tail kay big figure, gani? Ang dagan sa inyong tail na siya. Gets inyo? So again, tanawa ha, sa'yo ito ba na siya? Okay? Nana po lang sa yun, tanahon. Pero kung kamo mag-perform, animal. So again, place the bandage on top na siya. Uy, ala! Wow! May iko ko mo dyan! Oh, ipatid din si Patitas. Sakto din niya. Alright, so again, one of the tails are diri sa forearms, then the other tail will be on the arms na siya. Okay? And let the two tails meet on top na siya. Tanawa, ayaw ninyo higta. Ayaw po ninyo i-twist ang inyong tails. Igo na gid sila mag-agi. Then switch na po sila of sides siya. Ari na po siya sa forearm, ari na po siya sa arm, and then higo na square na naman. Okay, again, if you notice, ma-secure gid ang elbow ni patient. Dili gid niya ma-straight na siya. Gets inyo? So that is for closed elbow fractures siya. Okay? Sige, perform. Yan na yan. Maski na po magtanong ko, lamiya ka ng kuwanin. Lamiya ka ng tagtawon ba na kanang display kay wala siya puti sa puti na siya. Okay, so if ever mo gawa siya bukog, don't forget if there's any bleedings na siya, you have to control the bleeding na siya. Then after that, you also have to cover the bone itself with sterile gauze na siya. Remember, your skeleton is kanang internal part na siya. You have to make sure na limpyo ra po na naka-cover niya. So cover it with sterile gauze. After you've covered it with sterile gauze, and that's the time you are going to apply the triangular bandage na siya. Okay. Now, the first thing we need to do is cover the fracture itself together with the gauze na siya. Cover it with kanang bandage na siya. So to cover it, dapat ang inyong gamitin is semi-broad na siya. Kaya nga naman, dako-dako ba ng area sa elbow ni patient na siya. So we'll be using as a papaana laki para makita nila. Okay? So tails will be on the, remember this one, if this area is fractured na siya, there's also a possibility na ang iyang injury might also reach up to the shoulders of your patient na siya. Now, if you're going to apply, call this, arm sling na siya. So let's just say, apex niya, one of the tails is sa babaw, then, nung sinawa gani, can fold ka din, then supposedly, one of the tails should be on this side, di ba? Yeah, but because this shoulder is injured na siya, dili pwede magbutang na diha o sa ka-tail, kaya naman, ma-pressure ang iyang injuries na siya, kaya nag-alsabi na sa weight sa iyang kamot na siya. So instead of placing, bati ka may, instead of placing the tail there is a shoulder, agi ka under the arm. That's why it's called underarmsling na siya. So iko lagi na mo agi ang tail ninyo underarm, then ikot lang yapon mong square na rin. Then mo lang yapon, then roll yun lang yapon ng inyong tails, apex. Kasi same lang yapon. The difference is ni agi lang kita underarm. So that is what we call underarmsling na siya. Okay? Sige, go!
Here. So place it on the arms of the patient is here. So you just have to use one of the tails here. All you have to do is grab the tails on the outside, no? Dito sa gawas na siya. Then gonna grab it, let it roll in the forearms na siya. You can place one of your hands on top na siya, then it pass through back to the original sides na siya. Okay? The same tail gapa ninyo gamiton. Kuhaan ninyo, pero ari na po sa pikas side mo tuyok na siya. Okay? Ari kas pikas, ari na po